in our guidelines, we did attempt to look at the literature for other categories, including adults with special conditions and then children, as well as children with special conditions. Unfortunately, there's really only strong research for adults with end-stage renal disease. And there were quite a lot of studies of this in terms of that special population. And we did make recommendations that includes gabapentin, a form of IV iron infusion, iron sucrose, which we did not recommend in adults, but there was evidence for it in end-stage renal disease, and as well as vitamin C, good old vitamin C. So that was one category. And then, of course, the dopaminergic agents were recommended against, even in the population of end-stage renal disease. Unfortunately, a lot of the categories we would like to have data, particularly things like pregnancy or those with other neurologic diseases, there's just no research right now showing what treatment should be used. And we're looking at Alzheimer's disease, Parkinson's disease, where many individuals have to be on levodopa as part of their treatment, which actually might be making their restless legs worse at the same time. What do you do with individuals with Parkinson's disease? We would love to answer these questions. We don't have those answers. In children, iron is really going to be the key. Again, the research only supported ferrous sulfate as an oral iron supplementation. We couldn't even make a comment on IV iron, which is suspected to be effective, but there were no pre-post studies that used really strong validated measures, so we couldn't comment on it. So there needs to be research in these areas. And then a last area would be not really restless leg syndrome, but it's periodic limb movement disorder, which is an entire separate entity. Somehow it got smushed together with restless leg syndrome. And periodic limb movement disorder we're still at the stage where we don't really know what it is. We need to come up with ways of better figuring out the biology, the pathophysiology of it, how to diagnose it. It's probably exceedingly rare. If we can come up with a criteria, most of the treatments for periodic limb movement disorder did not show any type of benefit to any of the major categories and domains we looked at. So we basically recommend against a couple of treatments, and we don't have any treatments we do recommend. Our recommendation for periodic limb movement disorder is further investigation into how to diagnose it and what the nature of it is before we can decide to treat it.